burst into tears. And I was so upset that I went into the governor's office, looked around, went down the secret elevator, got in my car, and drove home in tears. So that's another lesson, which is don't do that. Because what was happening in the governor's office was the decision was being fought over as to whether he needed to call a special session for this particular one thing. And so I got a call at 1:30 in the morning to my house, woke me up, and it was the staff people saying, we've got a special, be here at 7 in the morning. And so we had a special session on one issue, which is really not a good idea to have a special session on one issue because there's no trading that can go on back and forth, to try to pass this legislation. And it came down to what was perhaps the first really partisan for health care. It wasn't about people getting emergency services. It wasn't about pregnant women getting coverage during their pregnancy, all of which were wanting to embarrass Governor White and keep him from winning something in this manner. And so this was when Representative Graham from the U.S. Congress is calling down to our members on the House floor saying, don't support it, don't support it. Votes were flipping back and forth. And on the third day of this special session, we ended up with a vote that was to table the whole bill. And there was a vote, and we prevailed by 5 votes. And then there was a call for the record vote. So they had a record vote, and we prevailed by, I think it was 1 vote. And so then they called for the process where they go through and verify the vote. And the guys literally line up and go down to the front and vote aye or nay, aye or nay, aye or nay. And it was tied. So in the special session, after all of this, we came down to a tied vote. And everybody turned and looked at the speaker, and the speaker's standing on the podium, Speaker Lewis, and he turns around and he looks at his parliamentarian, and his parliamentarian goes, and he turned around and he said, no, slams the gavel down, the bill passed, and we got indigent health care, which created the foundation of the county-based system that we have today. So those were fun and exciting things that I got to participate in, and the governor asked me then to head up something called the Health and Human Services Coordinating Council, which was the first effort at the state level to try to get a handle on the fact that we had 11 or 12 or 14 different agencies, all of which fell under this rubric of health and human services, none of which ever coordinated, all of which were their own little fiefdoms. There was no planning across state government as to different kinds of health, different kinds of, I see you laughing over here, and I appreciate your appreciation of this. And so this was a council that had the governor, lieutenant governor, speaker, the chairmen of all the relative committees in the House and the Senate, some public members, the board chairs from the major agencies. It was a highfalutin thing. And I tried to run that for a year, and then the election of 1986, Governor White was unelected, and suddenly, in the middle of all of this work that I was doing, we had a new governor. And I decided that I couldn't work in that administration because he had run on a policy that said, I mean, his platform was that he could cut $7 billion out of the wasteful Texas budget, most of which would have been in health and human services, and it was just something I couldn't participate in doing, and so I had to leave. So here's another lesson from my long and tortured career, eclectic career, which is you should always have enough money to have the freedom to walk away, if you possibly can. And I did. I left government and worked with Helen Fairby, who was a leader in Texas at the time on mental health and healthcare policies, and we created the Benedictine Health Resource Center. I worked with Helen and a small foundation that was affiliated with that, and that is now the Center for Public Policy Priorities here in Austin, which is really a great resource for people in Texas, and it grew to be a very strong thing. When I was running it, it was nascent, it was small, but it has turned out to be a really great resource in Texas. I volunteered then in the Richards and Bullock's campaigns in 1990, did a lot of issue work for and for Ann, and traveled with Barbara, who went around and campaigned for Ann Richards to be governor. We had a lot of fun on the campaign doing that, and we're together with the governor on the Sunday night before the election, when her opponent had said, who was a rich oil man, had been asked about his income taxes. And this was this was back when times were tough, and he says, "Well, I always paid my income taxes, except in 1986. I didn't pay any income taxes in 1986, and here's a multimillionaire who didn't pay any taxes at a year when everybody else was really, really hurting in Texas because of the OPEC oil crisis." And so we took advantage of that, and that evening I realized we were going to have a governor in Texas who was a woman. It was going to be Ann Richards. And we did barely win that election, and then I had to decide what to do, because I'd also worked with Bullock's campaign some, and basically I decided to go to work for the lieutenant governor instead of Governor Richards. And I did that for a number of reasons, primary of which is that I'd already worked for the governor, and I knew the limitations of the power of the governor's office in Texas. It's very frustrating. It certainly was then. It's, I think, maybe less so now. And then secondly, Bullock had talked to me very specifically about his support for an income tax for Texas, which I thought was vital, and the things he wanted to see happen in Health and Human Services. And so I decided to go with Bullock and work in the Lieutenant Governor's office. And that was the first year we had a massive budget crisis. Turned out I stayed very close with Governor Richards, and she would call me and I'd get to talk to her about policy as well, so it was kind of a nice position to be in there for a while. But we had a massive budget crisis, and that was the first Texas Performance Review, which I think Billy talked about before, but it was the very first one where they did a massive review of state government and said, what can we do? And we worked with them to come up with a recommendation to restructure all the Health and Human Services. And so we had 3 special sessions that year and restructured 30% of the state budget in special sessions between May 31st and August 15th. I'll never forget that date, to restructure the way that state government operates in terms of healthcare and human services. And that experience yielded what was a nicely organized chart, but without proper power to the executive, the commissioner of that entity. And so it kind of struggled along for quite a while until it's been strengthened in the last 2 or 3 legislative sessions. But that experience and working for Lieutenant Governor Bullock was an incredible one, and we came out of that legislative session. We had a big tax increase to make it all work, and in January of 2003, Governor Richards' folks talked to me, and I was ready to get out of the legislative system, and I thought it was time. I had done that a lot, and it was time to go and work in the departments and try to get that kind of experience. And so I went over as the Medicaid director for the state of Texas at a time when it was in severe crisis in terms of growth and budget constraints, and with projections for Medicaid that just went out the roof and scared everybody to death, quite frankly, including me. And so I naively went over. Bullock said, go over there, figure it out, and we'll fix it. And I went in to that job replacing or following a person who had been the Medicaid director for quite a long time. He was a double dipper. He'd been a military doctor, and then he had come back to work for the state of Texas government, and just hadn't really done anything for a long time with the program. And so I came in with this reform agenda, and states were doing interesting things, and basically started a 1.5-year process with wonderful staff, many of whom are LBJ students, to educate the legislature about the nature of Medicaid, the nature of the problem, the nature of health care issues more broadly writ, so that you could see why the Medicaid system was having the kinds of problems it was. And we created